Hi, I'm EJ Jameson from Los Angeles, California, Rochelle, and our son Kieran, and talk a little bit about EmCell. Kieran was born a little over 4 years ago with a traumatic brain injury at birth due to lack of oxygen. Since that time, we've done a lot of research on therapies. We've had him enrolled in a lot of physical therapies and occupational therapies, water therapies, things like that. And natural interest was in stem cell research and stem cell therapy. We were in touch with Dr. Bradstreet out of Georgia and did more research into the various stem cell clinics around the world and decided that EmCell was probably the best choice for us. So we've been here. This is our second visit now. The first time was almost exactly a year ago. And since that time, we've seen a number of improvements with Kieran, mainly in his cognitive functions and his abilities to understand and relate to external objects, other people, other kids, ability to understand that he can use his hands for things, that he can make choices and things like that. A lot of cognitive improvements. And in addition to some minor physical improvements, a greater ability to use his hands, to open his hands, an ability to motivate himself to walk and to play with other objects. Things you want to add?
After his first stem cell treatment last year, the teachers at his school noticed that he was making progress, and his therapists at his center also noticed he was making cognitive progress, and he made small gains throughout the year, which was fabulous because he had previously been at a plateau and he wasn't even making any attempts to try to do any socialization or just
interaction with other kids,
with other children, and it was just becoming very frustrating. So we were very pleased with the results, and we were happy to be able to come back and try again to see if we could, help him to improve again and make some bigger improvements.
One of the big changes we've seen also is that his original diagnosis for ability to do anything was extremely poor, that he would not be able to have any functions of a typical child. And the biggest one would be speech and communication, that he would have no ability to communicate, no ability to understand speech or to attempt speech. But over the past year, especially in the past several months, he's made numerous attempts to communicate. He's not saying specific words clearly that others can understand, but he's saying words. He says good night, and he says his name is Kieran and school today in his own type of language, but it's the ability to understand language and to make attempts at language that he's made a big improvement in. So that's an excellent, gives us a lot of hope for that.
One of our big goals is for Kieran is to be able to be more independent and do things on his own, unassisted, without my help or Dad's help, because it's very tiring when we have to do things for him all the time, and we'd like to see him do things for himself. That's very important for us as a family.
Because of the improvements we'd seen the last time we were here, we thought it was important that we make a second trip to Kiev and go through the treatment again, and hope we see a similar and proportionate amount of improvements.
We're really hoping that we'll see more speech development and more socialization skills with his other friends at school, with just the brain connections that we're hoping will be stronger, and he'll be able to communicate with us better at home in our environment. And then, what else?
Do we say goodbye?
Should we say goodbye?
Say goodbye. Say paka
You want
paka.
to say paka paka?
Say paka paka.
Yeah?
Yeah. Paka paka.
Thank you.